Weber and Rinne test, clinical examination part 1. The clinical examination of hearing loss should include the distinction between conductive and sensorinal hearing loss. There are different causes of sensorinal hearing loss, such as inner-ear disease or damage to the cochlear nerve. In all cases, the perception of sound waves through the air and bone conduction is affected. Therefore, sounds reaching the affected ear will be perceived to be quieter than on the unaffected side. There are two hypotheses that try to explain this phenomenon. First, impaired sound conduction is assumed to cause positive regulation of the inner ear, making it more sensitive to stimuli received through bone conduction. It also makes these sounds feel louder. Secondly, if sound waves cannot easily reach the inner ear, they probably cannot easily exit either. Therefore, these trapped sound waves could make patients perceive the sounds as louder. Weber and Rinne test tuning fork for USMLE. Weber and Rinne test tuning fork for conductive hearing loss and sensorineural hearing loss. They are also discussing absolute bone conduction, ABC, and the Schwabach test for hearing loss. Conductive hearing loss includes the area from the external ear to the stapes. Sensorineural hearing loss includes the cochlea and the cranial nerve 8. Using the Weber and Rinne tuning fork test, you can determine whether the problem is conduction hearing loss or sensorineural hearing loss. Air conduction occurs when the sound waves go through the external ear to the cochlea and the sensorineural area. Therefore, air conduction tests conduction and sensorineural hearing loss. In bone conduction, the sound waves travel through the mastoid, bypass the external ear, and activate the cochlea directly. Therefore, bone conduction only tests sensorineural. Rinne test place tuning fork on mastoid until the patient can no longer hear. Then place the tuning fork next to the external auditory meatus and see if the patient can continue to hear. Normally air conduction is 2 times longer than bone conduction. If bone conduction is greater than air conduction, then it is called a negative Rinne test, and there is a conduction hearing loss. Conversely, if air conduction is greater than bone conduction, then it is a positive Rinne test, then the patient is either normal or sensorineural hearing loss. If there is severe damage to the cochlea, then there can be a false positive. Weber test strike tuning fork on the midline of the forehead. Normally the sound will travel to both cochlea equally, and the sound will be heard equally, no lateralization. In the sensorineural hearing loss, the lateralization will go to the good ear. However, if there is conductive hearing loss, the sound will lateralize to the bad ear. Weber and Rinne test tuning fork for USMLE transcription. Alright, so today what we're going to cover is that can be related to the ear. Specifically, it's going to be all the tuning fork tests. So today we're only going to look at the tuning fork test, which is a clinical test that allows you to differentiate whether the patient has a conductive hearing loss, a sensorineural hearing loss, or even a mixed hearing loss is sometimes possible. So let's first talk about what is conductive hearing loss is and what a sensorineural hearing loss. So here we have a patient's ears. Then here is the head. Right now you have the ear, this is the outer ear, right here. Then you have your meat here, which is the tract here, the tympanic membrane. Here are your ossicles that go like this by the stapes is a final one. So then this will go into the cochlea, and you have the vestibular apparatus right there. So this is just a general look at it now. This part is the external ear, this is a middle ear, and this is the inner ear, which includes the external ear and the middle ear. Sensorineural hearing loss is pretty much the cochlea and the cranial nerve, so this is just the cochlea and the cranial nerve 8, and so using these tests, we can use the tuning fork. You can differentiate. We have two types of conduction. The first type is called air conduction and the second type is called bone conduction. The way to get air conduction is you take the tuning fork, to tap it against your knee or your elbow, whatever you prefer, and you put it right outside the ear. So when you put it outside the ear, the waves are going to travel through the tympanic membrane and hit the tympanic membrane, causing a vibration of the ossicles. And then it's going to get into the finally given to the cochlea. So hence, the air conduction goes through the conduction zone, the conduction area that we talked about, and the sensorineural area. Subscribe our channel for future videos, visit our website holisticmeaning.com for more informative articles.